Let's start our PMT, our Siddharth. He will take the session.
Good evening, sir. So, before starting, very good evening to all the eminent doctors of the back panel who are joined as a participant, and thank you so much for joining us in the today's webinar. So, our endeavor is to spread the awareness about the therapies, and which is very quite fatal and can be avoided once it is appropriately vaccinated. So, it is an initiative by the Cadila Pharmaceuticals through innovation to serve its uh, society and the humankind. So, topic of the today's webinar is the dosage reduction strategy in the rabies management, the role of a novel vaccine. So, dear Doctor, Thravis is the world's first novel 3-dose anti-rabies vaccine, and with a great pride, I would like to inform that Thravis has successfully completed 1 year of launch with more than 40,000 animal bite victims being vaccinated, and 100% of compliance has been recorded with no case of adverse drug reactions was registered. So with this, it's my pride, it's my humble request, and it's my honor to introduce you as a speaker of today's webinar, Dr. Chandra Kumar. He's an MBBS MD with a sound clinical experience in AIMS, New Delhi, and the JJ Hospital in Mumbai. Now we'd like to request Dr. Chandra Kumar to initiate the talk, and later we will have a quick question answer session. Doctor, over to you. Doctor, you are in mute. आप mute में हैं, sir.
Are you audible?
Yes, sir.
Okay, right. Very good evening. Welcome to today talks about the novel 3-dose G protein, ultimately of compliance. Are you audible? Hello? Hello? Hello?
Yes, sir. You're audible, sir.
Hello? Okay, right. Very good evening. I'm very happy that you selected and given me the topic about the novel 3-doses G protein vaccine ultimately of compliance. In fact, we have seen many of the cases, day-to-day practices, that the dog bite is highly ignored case and in fact highly fatal. And what's the reason about the fatality of this rabies due to causing rabies encephalitis? And the major cause is, I think, this is a poor compliance of vaccination. And sometimes I have seen many of the cases when the patient comes with the dog bite and he is very highly ignorant that the dog has bitten a very small pieces and there is no blood oozing out from the wound. And so I don't think, in fact, the patient tells me that there is no need to take a vaccination. But in fact, the thing is, there is no relation between how much the dog has bitten and how much the pieces of wound you have. In fact, the major cause of death is, in fact, the point number one is poor compliance of vaccination and ignorance of this wound caused by the dog bite. The thing is, you must have heard that why the dog bites. We cannot say, but in fact, the dog bites occurs in a really specific class of the people, like the people having the daily visits or Exapular or the rural areas where there is a very less supply of the rabies vaccination, and in fact, there is a bit less facilities of rabies vaccination. So that causes the fatality of this disease, because we are living in 2023, but there is no ultimate treatment if you got rabies encephalitis. So the measure of the treatment, in fact, it's not treatment. In fact, it is a prevention. This is a primary prevention. Is ultimate thing is the vaccination. When before era of 1930, there was 31 doses of rabies vaccines. 31 doses, the multiple sites of the body. As the day progresses and the science evolved, there is a 11 vaccination, and now the preferred WHO new guideline in 2018, there is a 5 doses of vaccinations. The 5-dose vaccination is also too much, because the patient will take like first dose, second dose, and third dose, fourth dose, and you know it's very strange that the most of the patient, like 54 to 60% patient, just forgot to take a fifth dose. So it's a very unique topic that the patient is covering with merely only 3 doses, and patient will get ultimately get safety neck. Rabies is a public health challenge in India. Globally, 59,000 highest in India. India has and 35% globally. 91% death in India occurred in rural areas, as we have discussed earlier. The current management of the dog bite is local wound treatments, first aid, active immunization vaccine, and passive immunization directly given to the wound. So the 5 doses intramuscular regime, as we have discussed earlier and we have seen earlier, that the 5 doses which is given on day 0, day 3, day 7, day 14, and day 28. That's anti-rabies vaccine. Vaccine is administered intramuscular in deltoid or anterolateral. Current challenges in the treatment of non-compliant. Current rabies vaccine or cell culture vaccine. Inactivated vaccines are greater than 50 years old technology, inconsistency in potency, stability, availability, short supply, and adverse event. Compliance anti-rabies vaccine. Compliant who received the full course of anti-rabies vaccine, that is the scheduled doses of ARV on the recommended dates. Delayed compliant who completed the scheduled dose of ARV within 60 days but deviated from the scheduled regimen. Dropout non-compliant who had taken at least 1 dose of ARV after animal bite but not complete all the scheduled doses. You can see the majority of the cases, the majority of cases of causes of death in hospital is, in fact, you can see here. You can regarding the post-exposure prophylaxis, the 3 places, the major cause of death is due to lines of the vaccines. Like first patient is 58-year-old female. Second one is 38-year-old male, and third one is also a 34-year-old male. You can see all the patient has taken 3 doses of vaccination. That is poor compliant instead of 5 doses. So outcome is whether within 60 days or later on the patient get discharged from the hospital, death is ultimate. Death is ultimate. Compliance to post-exposure prophylaxis among animal bite patient, a hospital-based epidemiological study at Safdarjung Jung Hospital, New Delhi. 360 animal bites patient, a pre-designed, pre-tested structured questionnaire was administered by the interview technique. 53% were non-compliant to the full course of anti-rabies vaccine. Compliance to anti-rabies vaccination in post-exposure prophylaxis. Municipal Corporation Hospital, Bangalore. We have taken the data from there. 1 doses of rabies vaccine administered intramuscularly on the days 0, 3, 7, 14, and 28 days as prophylaxis. Also major constraint for the compliance to the complete course. The compliance rate for the intramuscular rabies vaccine was 60%. Constraints for compliance complete course of anti-rabies vaccine interferes with full timing, distance of the hospital, cost. The major cause this. We have discussed earlier that the major incidence of the dog bite occurs in the rural areas or the people who is dwelling in the streets and villages or all that. So most of the cases are the person who is having the daily visits. The major constant for the major constant for compliance to complete ARV was loss of visits, 47%. Evaluation of rabies vaccine. The history started from 1885. Live accentuated vaccine, inactivated vaccines, inactivated vaccines, cell culture. The live accentuated vaccine was non-standardized dried preparation up to 31 injections of increasing immunogenicity. Inactivated vaccine, minimum neural content, liquid preparation, 14 injections, each 0.5 ml per daily. Inactivated vaccine, standardized immunogenicity, lyophilized, 5 injection, 0.5 to 1 ml, 037, 14, 28, discussed earlier. Non-compliance lead to the evolution in treatment regime from 31 doses to 5 doses and still on. Maybe some other day in 2035 you got only one vaccine and you get prevented. Maybe meeting the unmet medical needs, introducing a novel vaccine with a simple and a shorter regimen. Now,
डॉक्टर साहब म्यूट हो गए हैं अमित जी आप सब अब म्यूट हो गए यस
right?
यस
Are you audible? The
Yes,
novel
sir, you are
three
audible.
doses. The novel 3 doses recombinant rabies G protein vaccine. First protein subunit vaccine prepared by VLP platform technology. First vaccine with 3 doses intramuscular regimen, 0 to 7 days. Better compliance due to easy to flow regimen and less visit. Convenience, ready to use, no risk consideration needed. Novel 3 doses recombinant rabies G protein vaccine, I think, can be boon to the prevention of rabies encephalitis because it causes the less visit and I think so the cost would be also less due to the poor compliance is also the reason that the low visits people and the cost incurred is also a major sense. VLP technology. What is VLP technology? Native virus. VLP as a vaccine. G protein is difficult to stabilize. G protein isolation using VLP technology purified and stabilized by Cadila Pharmaceutical Limited. VLP are similar to native virus particles, but that do not contain the viral genome. They are capable of inducing a strong humoral and cellular immune response. Virus-sized particle VLP protein complexes exist as nanoparticles. They cannot replicate, but can mimic the viral antigenicity without being pathogenic. VLP as a vaccine. Safety and immunogenicity of a novel 3-dose recombinant nanoparticle rabies G protein vaccine administered simulated post-exposure immunization, a randomized comparator control multi-center phase 3 clinical study. Phase 3 study says to evaluate immunogenicity and the safety of rabies G protein vaccine administered as a simulated post-exposure immunization in healthy volunteers. You can see here the regimen 307 14 28 days regimen and 267 ribovirin vaccine. So in fact, here is a comparison between the 5 doses vaccine and 3 doses vaccine. That is VLP technology best new vaccine. The results were consistent across different age groups and genders. Observed difference 1.52% with the pre-specified margin of -4%. The study conclusion was novel 3 doses was non-inferior to the reference vaccine, less adverse effects compared to the reference vaccine. Novel 3 doses was found to be safe and immunogenic and was comparable to 5 doses of WHO pre-qualified vaccine. Awards also is given due to the VLP-based vaccine and 3 doses vaccine, the pharma innovation of the year by the Economic Times, and the Golden Globe Tigers Award, Malaysia for innovative product of the year. Thank you.
Thank you very much, sir. Chandrakiran sir, it's really very impressive, sir. You have a deep knowledge of sir anti-rabies regarding anti-rabies के बारे में सर आपको बहुत ही ज़्यादा मतलब ये अच्छा से आप deep knowledge you have, sir. So for behalf of whole Kerala family, sir, I would like to thank you for giving a wonderful speech of our rabies vaccine. And once again, I would like to thank to all the delegates who has here for giving your valuable time. I hope this session will give you much more important. जैसा कि आप लोग जानते हैं कि more than 1 in every 3 patient miss to complete 5 doses anti-rabies vaccine and at risk of fatal rabies. तो मैं जितने भी डेलीगेट्स हैं हम लोगों से रिक्वेस्ट करेंगे कि जहां भी देखें रैबिस पेशेंट यूज आवर रैबिस सर 0 डे 3 डे एंड 7 डे. तो सिद्धार्थ सर कुछ बोलेंगे सर?
जी बिल्कुल सर, एंड इट वाज अ वेरी नाइस इंटरेक्टिंग विद डॉक्टर चंद्रकिरण सर. सो काफ़ी अच्छा उन्होंने अपना एक्सपीरियंस शेयर किया, एंड इट्स अ वेरी गुड अपॉर्चुनिटी फॉर अस कि जो हमें रेबीज के बारे में पता नहीं है कि नॉन कंप्लाइंस इतना है, थर्ड डोज के बाद लेना देते नहीं है. So it's a very nice initiative by the Kerala Pharmaceutical, and it is a very very good. I really like to appreciate my Gaya team for conducting such a very nice webinar, and especially thank you to Dr. Chandrakiran for his valuable time. So thank you so much, Doctor, for for your efforts and for giving such a wonderful insight about the therapies. Thank you so much. And last but not the least, so we haven't all the audience who have joined, it's more than 50 plus audience, and मैं ये मानता हूँ कि it's an Indian innovation. तो हमारा ये कर्तव्य है रेबीज के प्रति, तो हम इस रेबीज को जड़ से बिल्कुल मिटाएंगे with the therapies. Thank you, doctor. Thank you so much.
Thank you, Siddharth bhai. Thank you very much for your presence. Is also important for us. Thank you. 50 पार्टिसिपेंट आए थे.